Ladies and gentlemen, good evening. Permit me, of course, to again recognize Professor Dr. Green, who has consented to be our featured speaker for tonight. He has come from quite a distance to be here, and so we really are grateful for his presence tonight. I'd like to also recognize Sir Edmund Lawrence, our former Governor General of St. Kitts-Nevis, the distinguished members who are representatives of the governments of Taiwan, the Republic of China, and also the Venezuelan embassy here in St. Kitts-Nevis. I would also wish to recognize a former minister, Deputy Prime Minister, I should say, Dr. Martin, and also a former Chief Medical Officer, Dr. Patrick Martin, who are with us here tonight. Hazel Ross Robinson and her husband, Hazel, has been working with me for several years. It's been my featured writer. Very grateful for that. Of course, we have Mr. Ed Mead, our former Chief Secretary. And I want to recognize in particular Mr. Liebert, Cedric Liebert, former Minister of Government, who worked with me for many years in the Labour administration that I led. Denzil Sharp is most present, has agreed to be one of our members of the Board of Governors. And all those who are here with us tonight, I want to thank you for being here. You are here to witness the launch of the Global Lifestyle Foundation. And this is a very special moment in the history of St. Kitts and Nevis, and a very special moment in my own life, because you could say that the desire for a foundation such as this one began taking root more than 60 years ago, when I was but a small child in the then cruelly neglected parish of St. Paul's, Capistier. Permit me, however, to first tell you about the mandate of the Global Lifestyle Foundation, because in the process of doing so, you will very easily understand how this foundation is a logical and integral part of the 60-odd year continuum that has been my own life. The primary objectives of the Global Lifestyle Foundation will be to promote human health and well-being, to encourage practices that combat climate change, to emphasize sustainable energy, to facilitate lifelong learning, to support sustainable economic ventures, and to stress youth and female employment. What, you might ask, could possibly be the link between my long ago childhood in the very rural St. Paul's and the launch of this foundation tonight? And the answer is really everything. You see, St. Paul's in the 1950s It was a place of glaring contradictions, with its rich, fertile soils and the non-stop labor of its workers, as it was a major contributor to the wealth of our country, especially St. Kitts. For the men, women, and children whose labor produced this wealth, however, St. Paul's was a place of severe economic, educational, and medical deprivation. I witnessed these realities and this contradiction all throughout my entire youth. At the same time, however, I was also keenly aware that despite our material deprivations, the compassion of the men and women in my village, the social cohesion that was all around me, and the spirit and the strength of the people of St. Paul's was truly extraordinary. I, for example, never knew my own mother because she died when I was an infant. Yet I was, in truth and in fact, blessed to have countless mothers of all ages. Women who, along with my father and older siblings, cared for me, protected me, looked out for me, loved me, just like they protected and looked out for the other children in our village. And as we, the children, grew, it came naturally to us to look out for and protect and care for the people of our village as well. So the people around whom I grew up may not have been materially wealthy, but we were emotionally and psychologically one. Own psyche, from my earliest days, an understanding of the power of compassion, the power of concern, and the power of action to transform lives. The men and women of St. Paul's taught me by their example that it is not enough to simply empathize. It is not enough to simply be concerned. They showed me those many decades ago how empathetic action could transform lives. And as a result, transforming lives is what I decided I set out to do as a doctor, as an elected official, and as the founder and chair of this foundation, the Global Lifestyle Foundation. There is another powerful lesson that was brought home to me as a child in St. Paul's as well. And that lesson, too, has stayed with me all these years, leading me to medicine, to government, to the Global Lifestyle Foundation. I recall that when I was a child, a secondary education was the exclusive preserve of a horrifically thin sliver of the population. At 12, I had competed for and had won a highly valued and extremely rare scholarship to the St. Kitts-Nevis in Gwilla Grammar School. When I reported for orientation at the school, however, it was being decided unilaterally and unfairly to deny me a secondary education and to instead award my hard-won scholarship to another child who, in my opinion, was less deserving. While I had anticipated simply taking my place in my first form classrooms that day, My father and I, we were forced instead to trek down to government headquarters, where we urgently tried to get a message to Mr. Bradshaw, now our first national hero, the Right Excellent, that the scholarship he had financed was being taken from the child who had won it in order to award it to someone else. What that particular experience taught me, ladies and gentlemen, was the power of intervention, the power of agency, the power of representation. Because were it not for the intervention and the agency and the representation of Mr. Bradshaw on my behalf, had Mr. Bradshaw not been ready and willing to intervene on my behalf, my life obviously would have been totally different to what it is today. And so, like the caring ethos of the St. Paul's community had during the first 12 years of my life, Mr. Bradshaw's firm intervention when I was being denied the opportunity for a secondary education also had a dramatic impact on my own psyche. It caused me to want to be able to intervene on behalf of others when I became a man. And so, ladies and gentlemen, intervention became a dominant theme in my own life from there onwards. I have intervened as a medical doctor to replace sickness with health. I have intervened as a medical doctor to do whatever I can do to bring wellness and good health to our people. I have intervened as an elected official to deliver land to the landless and homes to the homeless, and educational advancement to those in need of a real chance of self-empowerment. But it was also the power of compassion that drove me year after year for the last 29 years to provide at least 10 scholarships per year to deserving students at both the primary and the secondary school levels. I also want to submit that I have intervened as chairman of the Small States Forum of the World Bank to bring greater awareness of the international financial institutions to the underdevelopment of our countries, resulting from the devastating effect of climate change phenomena. We've had hurricanes, sea level rises, floodings, and of course, food insecurity as a result. In fact, it was the devastating effect of Hurricane George back, I think, in 1998, November, that evoked my own compassion to philanthropy and eventually caused me to launch the National Children Fund to assist our disastered children who were displaced from their homes so that they could quickly return to a state of normalcy and return to their normal lives. This particular children fund eventually evolved into the St. Kitts Charity Fund, which now has been evolving into this Global Lifestyle Foundation. I believe that today I build my own lifelong habit of constructive intervention through the Global Lifestyle Foundation. The Foundation's Board of Governors, the Advisory Committee and staff, ladies and gentlemen, will seek project proposals from organizations and individuals who are committed to the production of cohesive communities, sustainable employment ventures, and environmentally sound practices. And so, in closing, I emphasize that regardless of race, regardless of religion or age, we must take greater responsibility for our personal health. Unhealthy diets, inadequate exercise, and excessive stress are causing spikes in entirely avoidable diseases like hypertension and diabetes and cardiac diseases, demanding greater and greater percentages of government budgets and denying countless individuals full and healthy lives and lifestyles. Access to medication, I emphasize, it must be a right. Access to community health services is a right. Data-rich, readily accessible healthcare infrastructures, they are key to any region. And it is this awareness that caused me to push for the establishment in 2011 of the Caribbean Public Health Agency, together with friends like Professor Green here. Frightening illnesses like HIV/AIDS do not have to mean a death sentence anymore. And that is why I worked to bring about dramatic decrease in HIV infections in our region and to severely cut the rate of mother-to-child transmission, so that today, St. Kitts-Nevis is among one of the few countries in the world that can boast of having no child today being born with HIV. At home and abroad, ladies and gentlemen, healthy nations require cohesive communities. And with this in mind, the Global Lifestyle Foundation will promote and support projects that facilitate cooperation among youth groups, among civil society, and public sector agencies. The question then is being asked, what will Douglas do with this Global Lifestyle Foundation? After serving for 20 years as a Prime Minister of our blessed country, what else is Douglas here to do? Douglas wants to see our country truly prepare for the transitioning of true leaders of our country, so that they would be able to steer this blessed land into a direction that will, in fact, yield to every single man, every child, the opportunities that we all have. There is much more work I believe I can do. And as I assist to transition the leadership of this country, there's much more work beyond transitioning of the leadership of our country. The Global Lifestyle Foundation, I pledge, it will become the main vehicle through which my energies will be absorbed and pursued to make our country better. Ladies and gentlemen, your being here is deeply appreciated by everyone who has worked so hard to transform the dream of this foundation into reality. We pledge to you, and I pledge to you, a body of work, a history of interventions, and a code of transformation in the years ahead, of which we will all be most proud. Thank you.